How to do that, right? Can you just work your magic with, with the electronics?
I'll call Bobby.
Well, it is. I already called Bobby. he helped me somewhat, but it's still not right. Anyway, it is 8:18 on your morning, and we've got some Christmas music playing in the background. We'll get back to that in just a little bit. But today we're going to be talking about cold laser spinal decompression. Sounds like a fancy term for what exactly, Dr. Bob?
Well, actually, it's a non-surgical treatment option for degenerated discs or bulging discs, herniated discs, spinal stenosis that may be causing sciatica. You know, in the past, really, the only treatment option you really had was surgery or bed rest or medications. But that really shouldn't be the first choice, and you should explore some other options. And what we did in our office is we took multiple modalities and treatment options and put them all together in a single package. I think that's the strength of our office. That's what we've been doing for a number of years. We take a little bit of techniques that, you know, multiple practitioners may be doing, put them all together, and say, you know, I think if you package them all together, they have an effect that elevates a little bit more each and every one that you layer on top of. And so we developed a cold laser spinal decompression program that we get fabulous results with.
And I know I've spoken to you before. My memory banks are coming back to me about cold laser. And when you usually think of lasers, you think of, you know, something that's not necessarily cold. But, of course, in surgery, there's different types of lasers. And what exactly is a cold laser?
Well, a hot laser is used in surgery. It's used to actually cut tissue,
right,
where cold laser is actually used to heal tissue. And it does two different things. So primarily what a cold laser will do is it will penetrate based upon the power and the wavelength that you're actually using within that laser to penetrate different tissue lengths to achieve tissue healing. It will do multiple steps of going all the way down to the cellular level and allow the cells to repair themselves down at that level, stimulating mitochondria just by activation of some light down in that region. It will increase vascularization. It increases some of the cells that are designed to actually heal that tissue, and it does it at a much higher rate of healing, and it does it more completely. So that's part of the program. Our flagship of this is really the spinal decompression table, which is a table that you will lie down on, and spinal decompression is a form of traction, but not all traction is spinal decompression. So what you'll do is you'll lay down on a table, you'll position the patient in a certain way based upon the examination findings. You find out whether the disc, from an exam, you can have a pretty good idea whether a herniated disc has rotated, has gone over to the posterior lateral aspect, whether it's going straight back, whether it's going sometimes even anteriorly to produce some back pain. So we'll position the table in a certain way to be able to help move that disc. And then what it does, you're strapped into a table. Basically, it's kind of like a traction. You're laying down, right, you're supported up above, and you're pulled from your pelvis. But what it will do is positioning is extremely important to be able to target that disc. And then what it will do is it will stretch you slowly. And the beauty about spinal decompression is that we'll actually measure the resistance that your body's given. So you're never going to get hurt on it. And so what it will do is it'll apply the proper amount of resistance to be able to distract the disc and pull the disc back in.
Now, Dr. Bob, how do you determine what the positioning of the disc is prior to getting onto this device?
Well, during an examination, when somebody comes into our office, every new patient comes into our office, we spend at least an hour, usually a little bit more, to be able to help, to be able to go through the proper sequence of tests to be able to determine what's going on. We always will do a complete orthopedic, neurological, and chiropractic exam where we're checking reflexes and muscle strength and sensation. We'll move your body around in different positions to find out what positions aggravate your pain and what actually makes them feel better. So we get a chance to be able to isolate those particular tissues. We always x-ray. That's extremely important that you x-ray the area.
You have an x-ray machine right on the premises.
We do. We have a digital x-ray system that is actually connected to all the monitors throughout all the rooms in our facility, so all the doctors and everyone can actually have access to the x-rays as they're seeing them. It's really important to be able to do that, because if you're dealing with, let's just say you're not even dealing with a pathology like a degenerated disc or spinal stenosis or something, even congenital anomalies, something that you were born with, and they're very, very common. You know, you might have an extra lumbar vertebra, or you might have a fusion of one side of a vertebra as opposed to another, or you might have a thing called DISH. We've been seeing a lot of that, diffuse idiopathic skeletal hyperostosis, where these...
Wow.
Where these...
I'm glad I don't have to pronounce that.
Well, it's where the spine starts to fuse itself down, and it's they believe it's an autoimmune condition right now, but they hadn't been able to classify it before. But if you break it down, diffuse means it's all over the place. Idiopathic means we don't know what causes it. Skeletal hyperostosis means there's large, massive bone spurs, and there's a lot of people that have that. You don't want to go adjusting into that spine, and you know something, without an X-ray, you're never going to see that stuff.
And what about like just older patients who get like curvature of the spine, get what do you call it? The
compression fractures.
They have arthritis.
Mm-hmm. Yeah, sure. I mean, that you have to see that. You have to see it. It just gives you a map. You know what I mean. I can say, Phil, why don't you leave here right now and just drive to San Diego? But it's a little bit better to be able to have a map or GPS to be able to give you that. That's what an X-ray does. So, you know, I'm pretty adamant. You know, I mean, rarely. I haven't had this happen to me in about 5 years. But sometimes, you know, a patient will come in and say, I don't want X-rays. I'll say, okay. And they go, I don't have to have them. Well, I'll just say, well, I can't treat you. You know, I'm not your guy. It's okay not to be their guy. You know, they can go get, as they would call it, cracked someplace. But I take much, much, much greater pride in what we do than cracking somebody. You know, so it's I mean, it would be the equivalent of just saying, yeah, my surgeon stabs me. You know, so
I see.
You know, so I think there's a lot of science in manipulation. You have to understand torque angles. You know, there's 3 dimensions of movements: X, Y, Z axis. You have to understand what direction you're doing to apply the force to actually move the disc, to move the facet joint, and take the pressure off the nerve root. So, the basic anatomy in your back, I'm going to cover in a couple minutes, and I'm going to go over why decompression, our spinal decompression laser program is so effective. If once you understand the anatomy and what it's actually doing, it's pretty impressive that you can do it without using surgery.
All right, we're speaking with Dr. Bob Olivieri. His location is in Rio Grande on Route 47. You can reach his office at 609-886-8585. Did I get that right? Okay. And we're going to get back to the music here. I believe we're in the middle of Mannheim Steamroller here. All right, that's not Mannheim Steamroller. That is Lincoln Park here on 98.7 The Coast. That is 8:29 on a tricky Tuesday. I say tricky because my computer is rebelling against me. I don't know what I did to it. Dr. Bob, I think it needs a little cold laser treatment. What do you think about that?
It might be able to help it.
It is 8:29 on your Tuesday morning. We got Dr. Bob in here to help us out, with our bodies. We got Mark Hunter in here. He's over my shoulder trying to coax the computer to do what it's supposed to do, but that's fine. We'll deal with that. We have a big happy family here, and we're talking about cold laser spinal decompression.
Right. So what I wanted to do is actually kind of like give you a little visual of what these modalities are all doing to your back. So if you understand the anatomy, I think you might appreciate some of the technology that's behind to actually treat this. So when you're dealing with your spine, you have your brain and your spinal cord that exits all the way down, and from your spinal cord you have nerves that leave there and they go to all your organs. They also up around your neck will go all the way down into your hands, and in your lower back will go all the way down into your legs. So that's why we check muscle strength, reflex, and sensation to find out if those nerves are being compressed. Now, if they're being compressed and going to your organs, there's no way to really be able to determine that, and that's why it's so important that I believe very strongly if you have a spine, every single person should be going to a chiropractor to get it adjusted, just like you go to a dentist to make sure your teeth are good.
Wait, I love that when you say that. If you have a spine,
right? Well,
so what does that mean?
Well, it's pretty obvious that most people have a spine, so every single person should be getting it adjusted, right?
Yeah, exactly.
It just really does make sense to anybody. It just makes a lot of sense. Besides the mechanical aspect of it, of localized back pain, that when the joints don't move, they deteriorate. Okay, and we're going to talk about that in a minute. But even at the greater level of which your nervous system controls every single bodily function, everything, it makes your heart rate, and it makes your digestion occur. It makes everything happen. No matter what it is, it allows you to go to the bathroom. It allows you to do everything. And
those things that you don't think about, like even breathe.
Right.
I mean, it's all related.
And that's controlled by the autonomic, or you can call it the automatic nervous system, the things you don't have to think about all day long. So that's being controlled. So if that's not working properly, or if the spine's not working properly, you're never going to know that. So if you have 2 vertebrae there, the anatomy is you'll have 2 bones, okay, and it's separated in the front by a disc, which is a shock absorber, and there's a soft center surrounded by denser tissue. tissue. But right behind that disc is the spinal cord that goes down, and that's where the nerves come out that will go to all the different organs. So if that joint isn't working, in order for that system to stay healthy, the joints of the spine need to be moving, and that's what chiropractors adjust when they get stuck. But the joints need to be moving. If the joint doesn't move, then the joint doesn't get nutrition, and the disc doesn't get nutrition. So if I ask you to wiggle your finger there, as you're wiggling that finger, there's a tissue fluid exchange going inside that joint, so the cartilage gets nutrition, so it doesn't become arthritic.
Gotcha.
That's how arthritis happens. So when the joint doesn't move, like if you didn't bend your finger for about 3 months, that joint is going to become extremely arthritic. The muscles around that joint are going to become atrophied because they're not moving, and they'll deteriorate it. So I can guarantee you, if you couldn't move your finger for more than 3 weeks, you're going to try to move it, right? You're going to make some conscious effort, and you have a conscious control of that particular muscle. But if I ask you to wiggle the joints of your spine, just take any vertebra and start wiggling it around. Can you do it?
I can't do it. My back will be moving.
Yeah,
not the actual vertebra.
Correct.
I can't quite control that.
You can't wiggle. You couldn't wiggle 3 of them in a row. You can't move them. So if those joints aren't moving, the joint's going to become arthritic. The disc is going to degenerate. So you only get 1 disc per motion unit, 1 disc between the 2 vertebrae. That's it. And when that wears away, you're done. That's it. You don't get any more. And so in order for that system to stay healthy, the joints of the spine need to move. And if you can't determine whether the joints of the spine can move or not, how about going and seeing a specialist that determines for a living whether the joints of your spine are working or not? It just makes a lot of sense because the ramifications are degenerated discs, herniated discs, and all those things, preventing those from happening ever. Number one. And number two, when there is a significant amount of trauma that maybe something like that happens, they can actually help treat it, and you're going to heal better. So if your back hasn't been working for 5-10 years and you take a fall on it, it's kind of like, the difference between a stick absorbing capacity and a straw, right? The straw is going to bend easily and the stick's not. Mm-hmm. So you want good pliability in the spine. The problem is that the average person can't determine whether those vertebrae are moving or not. So that's what a chiropractor does for a living. So you're going to restore the normal mechanical areas in those joints, getting them to work a little bit better. And then what you're going to do is you're going to allow the nervous system to function the way it's supposed to. So the most common 2 things that I hear a patient come in with, besides their back pain, neck pain, migraine, headaches, what everybody goes see a chiropractor for, but the most common things that you'll see is my digestion is so much better and I can breathe better. Well, guess what? When you can breathe better because your lung capacity can improve just a little bit more, you take in more oxygen, which makes you sharper, more alert, and more refreshed during the course of the day. Mm-hmm. So just those simple basic, and believe me, there's a lot more that's happening up in your brain when you're getting an adjustment than just that. But just those simple little things are well worth the fact that you should be seeing a chiropractor. I will never understand if we were basing everything upon just pure science. Everybody would go to a dentist, and anybody would go see their family physician. Everybody should have a chiropractor. I will hear every once in a while somebody said, "Well, I went to a chiropractor once." I was like,
yeah.
Right. So, okay, first of all, you went to once. It's going to the gym once, and you weren't stronger, so you left. Number one, or you said, "Oh, I hurt afterward." So, guess what? I went to probably 2 dentists in my lifetime before I found the perfect one that I like. Just because you went to somebody that you didn't like absolutely does not mean that you wouldn't not still go to another dentist, right? I mean, that's ridiculous.
Well, I've been going to the dentist all my life, and you have what, 32 teeth or whatever, 36, I don't know what the number is, and it's kind of like the vertebra in the spine. You have a number of vertebrae, and you gotta take care of them.
Right.
Makes sense.
It will never make, if we're just looking at pure science, like you go over in Europe, everybody goes to a chiropractor. Everybody gets manipulation. Physical therapists do manipulation over in Europe. Chiropractors do, everybody goes to one. It's just not really thought of. Even in the United States, you go to California, a large population, what are they, like 86% of the population, but nationwide it's down to like 22%, so I think we're getting better, though. It used to be when I first started, it was probably down to about 15%. So we're getting better. We're educating patients. And patients, something, they know. They automatically know. They walk out, they know the difference.
We're talking with Dr. Bob Olivieri. He joins us every Tuesday here on the radio. And we're going to try to move on here. Mark Hunter, I think he worked his magic here, so we'll see what happens. You're listening to 98.7 The Coast. We're scheduled for break. Jackie Money's coming in to talk. And it is 8:36 here on your Tuesday morning.
This update is brought to you by Cape May State.
We're talking with Dr. Bob Olivieri, as we always do on a Tuesday. It is 8:49 on your Tuesday morning. Dr. Bob, this time we're talking about cold laser spinal decompression. We're talking about some of the basics of chiropractic and people that come to you with issues, problems, and how you treat them.
Sure. So what this program is designed to do is to handle people that have bulging discs or herniated discs and spinal stenosis, quite often causing sciatica. So when you get some back pain that starts to radiate down into your legs, that's when it starts to irritate nerve roots. Those nerve roots come together and formulate a thicker nerve that goes down the back of your leg called sciatica. So this program that's really designed to actually rehabilitate that is more than just spinal decompression and cold laser therapy. It involves exercise. It involves what we call vibration therapy to fire off different centers up in your brain to be able to help stabilize the little muscles around your spine that you don't have any control over. And it involves one of the exercise techniques called an ATM, active therapeutic movements. Not the place where you draw money out of.
Okay.
Which is a really interesting device. What it does is it kind of like straps you while you're standing. It kind of like gently straps you into up against a pad, and then it has you do movement patterns in a pain-free environment. So what it does is, like, lots of times pain will be produced from a joint that is hypermobile, moves excessively, and it's another area that's not moving at all, not even near where the pain is, that produces that whole problem to break down. That's why it really does take a really well-educated chiropractor to be able to find those areas that aren't moving, and they may not even be near your painful region. So we restore the entire biomechanics. So ATM, the active therapeutic movement exercise program, will secure those excessively moving joints down, and then it allows you to move through a pain-free range of motion. So it's telling your brain, basically, it's okay to move this direction, because your brain, when you have an injury to one of the joints in your spine, you have these little muscles that you don't have any voluntary control over that we talked about the last segment.
Right.
And it will splint your spine down. So muscle spasm, in essence, are actually pretty good. If you sprain a joint and the muscle that moves that joint tightens up, it's telling your brain, we don't want you to move that joint, because more movement to that joint is going to cause more problems.
Gotcha.
More pain, more inflammation. Just like you wouldn't want to go and you sprain your ankle and then just go out and start running on your ankle again, right? Mm-hmm. So, those muscles are splinting your back down. So to me, it doesn't make a whole lot of sense to give somebody a muscle relaxer to relax the muscle that is designed to splint the joint so it can actually heal, right?
Right.
Doesn't make any sense. Mm-hmm. That's like removing somebody's brace. Mm-hmm. So there is a time and a place when those come into play, but more of an anti-inflammatory approach of controlling the inflammation initially, which would be ice you put on that area, because that's the most powerful anti-inflammatory that we know of. Apply that particular area until the inflammation goes down, and then slowly start to guide movement back into those joints with some manipulative therapy or spinal decompression to be able to allow those ligaments that have been torn to actually heal properly with regular ligamentous tissue. That's where the laser comes in. It's actually going to, instead of allowing it to heal with scar tissue, it's going to allow it to heal with just normal, regular tissue. So that's powerful. Then, as the inflammation starts to go down, you gently go through some very simple spinal stabilization exercises, and you'll progress all the way up into a little bit more of harder, stronger exercises to give further support to that spine. So it's a progression, and so it's a very detailed program. It's a 6-week program that we use in the office, but it's highly successful. We have, if you go to our website, we probably have 50 video testimonials on people that have been possibly either scheduled for surgery or have been told that they're probably going to need surgery at one point in time. And so we've been really lucky with this, and we've been implementing this program for quite some time. Actually, we've had it.
We're speaking with Dr. Bob Olivieri. His location is on Rio Grande Boulevard, Route 47 in Rio Grande. We got a couple minutes. What else did you want to talk about regarding this?
Some of the things when we start talking about anatomy, like when we start talking about how the spine is and how special it really is, those little muscles are controlled by a little different part of your brain. So if we're going to go, the front part of your brain, I'll go through some really basic neurology. The right side of your body is controlled by the left side of your brain.
Okay, I've heard that. Yeah.
The back part of the brain is your sensory cortex, allowing you to feel things from the right side of your body. The front part of your brain is the motor cortex, allowing you to move that side of the body. So you'll get, let's say if you injure your finger, it travels up the nerve, goes up to your spinal cord, goes over, crosses over to the back part of your brain, and there's actually a map of your whole body in that back of your brain. So when your finger lights up, there's a part of your brain that lights up also. So then it's going to communicate to your frontal lobe, which is in front of that, which is your motor cortex, will go down and tell you to move your finger. Okay, so that's why you're allowed to move your fingers. You can move that and have voluntary control over that. You feel pain, you move it off the stove or something like that. However, the very back part of your brain called your cerebellum, which is responsible for balance, coordination, posture, that fires down to the small little muscles of the spine that you don't have any voluntary control over. So anytime you're going to do any spinal rehabilitation program that involves active movement in that, you have to involve balance, coordination types of things, because you have to fire the pathway up to the cerebellum, back down to the small little muscles, the intertransverse areae, the multifidi muscles, the rotator muscles, those muscles that you have no control over. That's why you can't wiggle the vertebra, but those muscles wiggle the vertebra. Okay, so it's really important to actually add that into a program that's actually doing this. So our program is extremely comprehensive. It really is. I kind of make it seem like it's pretty easy, but there's a lot to it. And, that's why I think people get better in a really short period of time in our office.
We're speaking with Dr. Bob Olivieri. We're going to talk to him a little bit more about this cold laser and how that all involves the spinal decompression treatment. So keep it here for, again, every Tuesday. I always learn something from Dr. Bob. Thanks for joining us. We'll be back with more. Okay, Dr. Bob? It is 8:55 on your, Tuesday morning. Yeah, I'm okay. Let's see if we got this. We got Elvis coming up here on 98.7 The Coast. It's 9:09 on your Tuesday. We're here with Dr. Bob Olivieri for final thoughts on spinal decompression using a cold laser. Now, how does the cold laser fit into this again?
Well, what you'll do is after you go through an exam and we determine what tissue we really want to target, the cold laser will target right down into the area that requires some of the healing, whether it be right around the disc or whether there was some muscle injury or some ligamentous injury, and it penetrates. We'll set the certain depth of the penetration to it, and it'll help repair the tissue. So we have an M6. We have a $65,000 robotic laser. Not all lasers are created equally.
Gotcha.
And so what it will do is it'll target the range there, and it's a robotic one, so it's even unattended. You don't have to, man it while you're actually, rubbing the area. So,
but what's it? We've talked about this laser before. Have you come up with a name for the laser?
Well, it's the M6, so it has its own name.
M6,
but
okay.
no, we didn't nickname it
like
or anything.
HAL or anything.
No, we probably should, because it really does look like something out of Star Wars.
Okay,
it really is. I mean, when you stand it up tall, it's taller than I am. So,
oh, really?
Yeah, it's pretty neat.
So what do you got coming up? Feel Great Nate, neuropathy. What's going on?
Not this Thursday, but next Thursday is Feel Great Nate, and it's extremely well attended right now. This is great. Like, we're walking in, and every night there will be like 12 people exercising, and it's and we also have morning classes and stuff. So it's nice. It's going over really well. People are getting the message. Like, they're telling their other friends, like, this is the very best time to join Feel Great Nate, and they go, oh, it's before the holidays. I go, it is, but you're using up all of your insurance benefits from the year before, number one, and you learn how to eat during the holidays. I took a poll of every single person that's actively going through the program. I go, did any of you struggle at all during Thanksgiving? They're like, absolutely not, because a Thanksgiving meal is pretty much what you're allowed to eat on Feel Great Nate, except minus probably the stuffing, so little sacrifices, and everything else is pretty darn good.
What about the gravy? You allowed to eat that?
Well, you can have the fixings there. You just can't have the unless they. Well, I mean, if you use some almond flour in it, sure, you can use it. It just depends upon some of the ingredients you have. You're not going to use any wheat product, so it's really not that hard. It's meat and vegetables, all you want, so it's pretty simple. But you have to remember, it's only 8 weeks. You're detoxifying your body. So, you're allowing your liver to detoxify and for new, just incredible health, and allowing your intestines to heal the way they're supposed to.
How would this compare to like a cleanse? That's pretty hip these days.
Well, it's one of the two aspects of it. One's a liver detoxification, which is a cleanse, but you don't ever want to cleanse a body into a system that has holes in it, right? Mm-hmm. So your intestines have little leaks in there. So that's why people feel so ill after a cleanse, because they don't know what they're doing. Really, I have a lady who's going through the program right now, highly intelligent. I mean, extremely bright.
Right.
But she just needed a system. She needed to put it all together. I mean, she could recite every word that's ever come out of my mouth. She just never had a system on how to put it together. Mm-hmm. And she a lot of people get really bad information off the internet. This is a system. This is a really tried and true system. It's been going on for like 8 to 10 years.
And it's comprehensive.
Extremely. I mean, I wish I could get into all the stuff that it's really doing. How resveratrol, we're giving you stuff for neurotransmitters. We're giving glutathione. One of the things you're having in there, you're having glutathione recycler. If you Google glutathione, one of the things you're going to see is a neurologist injecting that into a Parkinson's patient that can't even walk up and down the hallway. He injects it for a half hour and has him, and the guy's skipping down the hallway. Glutathione is a powerful anti-inflammatory that affects all cells in your body, but primarily up in your brain. So if that's part of your program. To be able to help detoxify your body. It's powerful. There's so much science. You just have to come to a workshop. I think you'll be blown away with it. I've never had a single medical doctor go through our program ever, because everybody has to go through the workshop. I don't care who you are. You have to go through it to learn it. That didn't sit there and go, wow, I had no idea it was this comprehensive.
And there's some information online. How can people find out more online?
You go on to OlivieriChiropractic.com, and we talk about it. But the majority of the information right now is coming from the workshop. We're going to start to try to videotape them and start to put some stuff online, so other people, you don't have to attend the workshop. Because honestly, I do it out of passion, but it takes a lot of time out of my day to be able to do it. And Feel Great in 8 is the most reasonably priced program you will ever find in your life for what this thing does. And I will admit, I've been saying this all along, but next year the price is going to change. It is. It's so comprehensive, and there's a lot of work behind it that it is going to change. But get out, you come in January, and you'll still have the same price that's what we're doing this year.
All right, Dr. Bob Olivieri at Olivieri Chiropractic, 609-886-8585. Thanks for joining us. We'll see you again next Tuesday.
Thank you for having me on.
All right. It is 9:14 on your Tuesday. I did not forget about the Lucky Numbers game. Okay, I don't think that I forgot about it. You have until 10 o'clock to get involved in that. We're going to announce 2 numbers, and if they match the numbers in your phone and you call us up, you will win a very great prize. So keep it here for some great Christmas music. Up next, we got Pentatonics, followed by Darlene Love's Christmas Classic here on 98.7 The Coast.